Hello, my name is Larry Watts. I'm a physician in Clinton, North Carolina. I want to welcome you to Vision of Unity. We have plans for several presentations of things that would be of current interest to people in our area, and we'll try to actually have current statistics for our immediate region. Today we wanted to add a talk on immunity and things that you can do to help with COVID. We know that the risk of coronavirus is great, and there is, of course, as you've seen, there's nearly 9,000 deaths as of today. We know that 0.5 to 2% have superimposed pneumonia, that is bacterial or viral, very dangerous at this point. We do have respiratory equipment. As you've probably seen our president trying to pull together, I would have to tell you that is not something we want our people to get to that point. That is not a great survival rate, as our president was not wanting to mention to people. And so doing things beforehand. Coronavirus, colds, SARS, which was started from cats, MERS, which is Middle Eastern respiratory syndrome, is from camels. And we know that this virus is probably from bats and other animals that were spread, and we call it the novel coronavirus, COVID-19. The new name that is going to be scientifically registered is SARS-CoV-2, but we know that there's an infection and incubation period that typically is 2 to 12 days, but oftentimes more than that. We use 14 days as our usual isolation time. If you are a suspect case and our family, we go out to 14 days. There has been cases documented to 24 days in China. But we know fever, headache, dry cough, sore throat, nasal congestion, shortness of breath, and ultimately pneumonia are the biggest concerns that we have with this. Your part, which is the first part and probably the most important part, and you've been seeing this on news media, clean and wash your hands with alcohol or soap and water. The CDC actually has guidelines for even washing your hands. It's a 20-second washing period. Cover your nose and mouth with tissue or elbow when coughing or sneezing. We know that sneeze can project over 17 up to 20 feet. It's been documented. Avoid close contact with anybody with cold or flu-like symptoms. And any known person in contact with COVID. We know that many cases are asymptomatic. In fact, our first preliminary data is there's about 1.4% of the population at least would be asymptomatic, have no symptoms, but yet could be contagious to you. We know cooking meats and eggs and so forth thoroughly would probably be of help. We know that there's many lines of defense. One of the lines of defense that we think about is your white blood cells. We know the white blood cells are made of several things. One of the first lines of defense would be macrophages, subset of these white blood cells, monocytes. They become phagocytes, and that what that is that they surround organisms and destroy them in our body. So that's one of our first lines. The neutrophil invasion goes to affected areas in about 1 to 2 hours, and of course the monocyte invasion converting to other offending agents, followed by a bone marrow increase that takes place in about 3 to 4 days, and that can be high enough that it can increase your white blood cells 20 to 50 times normal. So we know that there's lots of different effects. We know that the neutrophils destroy bacteria by phagocytosis, like we mentioned earlier. We have eosinophils turn off allergic responses and kill parasites. We have basophils, which emit histamines, which is like an allergic type of reaction, and they're mediators of other forms of inflammation. And lymphocytes mount immune responses through something called T cells, which is another whole separate discussion, of which many of the things we're going to talk about today are actually stimulated in that regard. If we look at some of the general things, agents that that you can do to boost your immune system during this type of a season and every season, including flu season. One would be rest. Another one would be warm liquids, copious amounts of liquids. Your body is 70% water by weight. If you don't like water, you don't like 70% of your body. So that's a very important thing to focus on. Tissue macrophages, which we just mentioned previously, part of your white blood cells. If we want to boost their function, one of the key vitamins that you could take right now that most researchers, the majority of them agree, is vitamin D is probably the most important. It's been discussed that if you have not been taking anything, you're traveling into a risky area, that you might take 10,000 IUs of this daily, which is a lot more than most doctors are prescribed. And we wouldn't do that continuously without being monitored by a doctor. There is such a thing as too much of a good thing. And many of these vitamins that are processed in the liver, they can build up and become toxic. Vitamins A, D, E, and K are some of those. And they all have good functions, but there can be too much of a good thing to the point where they interfere. There is actually a way to take a high-dose injection of 600,000 international units if you were going to travel to a risk region, which right now we would be a risk region as well. Zinc, very important, 50 and 100 milligrams daily. There are other forms of zinc that would include some of the people that have made knockoffs of some of our zinc throat lozenges, including Zicam and others. You can, of course, find that in a generic basis. And you can take lozenges at the onset of the symptoms. They're just 17 milligrams, the majority of the products that are out there. We have documented studies some years ago showing the average cold symptom being 8.3 days and decreased with functional use of this in the first 24 hours to 3.2 days. So we know that the coronavirus is 4 different coronaviruses are part of our common cold syndrome, which includes many other viruses. And so we don't know specifically about this virus, but we think it will probably behave like some of its ancestors. And so that's what we're talking from, is we're assuming it's going to behave like some of its predecessors. How do we help our neutrophils? Better than 60% of our white blood cells function. That's our second line of defense. One, avoid sugars and carbohydrates, which we have known for many years lower the functional activity. We know that being a diabetic, because of running high blood sugar, so being a diabetic in good control versus being a diabetic in poor control will have a significant impact on how our neutrophils will respond. Another one that's been discussed for some time, and that's vitamin C, which has been discussed in research in both viral and bacterial. We're talking about higher doses than Linus Pauling, who is the person that probably made vitamin C famous or on the map, and we followed his example. He's actually a Nobel Prize winner from UC Berkeley. I've had the pleasure to meet him at least twice, and while he was living, he passed away at age 93. So we know that vitamin C probably did not shorten his life. He did take 2 to 3 grams for over 40 years of his life. Another one would be flavonoids or phytonutrients from plants enhancing the function of vitamin C. Up to greater than 200 milligrams daily would be probably recommended. So we know all of those would help your neutrophils, which are a very important line of defense. Another one would be helping your bone marrow to produce more white blood cells. Remember, that's a delayed effect. And remember, we said that you can increase the white blood cells 20 to 50 times their current average dose. And vitamin A, taking 10,000, 20,000 units daily, has been researched and has been shown to increase production of white blood cells on a more favorable stratification or speeding up the response. Vitamin E, 800 international units daily. B6 or 100,000 milligrams daily. We know that the B complex would have probably a reasonable amount of B6 in it, but not quite at this level, but it would be better than nothing. We have various parts of our immune system studying, and we're going to try to post some of these online and give you details that you can go back and research so you don't have to remember what we're saying. But the thymus, your lymphatic system, the spleen, use probiotics. And then we just talked about the white blood cells, lymphocytes, monocytes, eosinophils, basophils, and also plasma cells. And so, the first line again would be the macrophages, monocytes distributed in tissues, phagocytosis, very important. Second would be the neutrophil invasion, affecting the areas in 1 to 2 hours. And then monocyte invasion, converting to other offending agents. White blood cells increased, as we talked about. That's a 3 to 4 day delay. Other things that you might go through, and we're going to give you a list of these. There's actually a detailed function in some of the studies that we'll try to also post for you so you can look at all of them. Oregano, sage, basil, fennel, garlic, lemon balm, peppermint, rosemary, echinacea, sambucus, licorice, astragalus, ginger, ginseng, and dandelion. So we've got lots of natural things that have been studied. Of course, many of our vitamins are derived from many of the things that we find in nature. When we look at the 8 best vitamins and minerals for supporting our immune system, we'll give you a list in alphabetical order, but probably if I was going to chronologically list that, our order that you'll be able to see visibly is vitamin B, C, D, E, folic acid, iron, selenium, and zinc. But I would probably put in the order of vitamin D, C, and zinc probably as the first 3. We can all go broke buying every vitamin that's available. In fact, if you've been into your stores recently, most of the vitamin shelves are gone. People are looking for anything that says immune on there. So we would like to pick and choose wisely when we're picking. They all have benefit. There's relative differences between the benefit. And we would love to hear your questions. If you have any questions on this and other topics that we'll be discussing. We had one that was done 2 weeks ago that had a number of questions, and we please invite your pastors or your friends and their pastors to join part of this link on Vision of Unity. We were asking pastors to give short statements of prayer and encouragement and different issues, and we would like to get our community involved to help each other. We also have, Pastor Rodney Hall will be announcing some of this, but we have several other announcements, including part of our group that has allowed Baptist men to bring in a refrigerator trailer to bring in food storage to our areas, and we have another food bank coming in, and we will give you information on that as well. Lord bless you. Be careful. Be safe. Be wise.